Our athlete is a 21-year-old female wrestler. The onset of her injury occurred 5 weeks ago while running outside and landing in a hole, causing her to evert her foot. The pain is worse while standing barefoot, and she describes the pain as sharp on the plantar surface of the medial longitudinal arch and heel. There is no radiating pain, and her pain is a 4 out of 10 first thing in the morning and after rest, and a 2 out of 10 while performing calf raises. The pain is worse in the morning with toe extension and ankle dorsiflexion. She has had no previous injuries to the toes. During observations, there is slight swelling on the plantar surface of the calcaneus, and our athlete has Fasciitis, meaning her arch is high. On palpation, there was pain on the calcaneal tubercle, which is indicated in the photo. Range of motion of the toes. During active range of motion, she had full range bilaterally with no pain. During passive range of motion, she had full range bilaterally with pain at the end of toe extension. During resisted range of motion, she had full strength bilaterally with no pain. No special tests were performed, so we will be moving on to the plantar fasciitis tape job, and the method we are using is the win-last method. Before we even tape our athlete, we need to do our pre-tape checklist. So this includes asking the athlete for consent to tape them, asking if they have any allergies to adhesive sprays or zinc oxide tapes, checking their skin, so observing to see if they have any blistering, lacerations, or just going through your DCAP BTLS acronym. Then we check their cap refill for 1 to 2 seconds, their sensation, and their movement.
With our patient in a comfortable position, either supine or prone, we'll start by checking circulation, motion, and sensation. We'll then add our anchor strips using a zinc oxide tape, starting at the first metatarsal, coming around the calcaneus onto the lateral side, and landing on the fifth metatarsal. Our second anchor will start at the first metatarsal, coming right across the plantar fascia and landing on the fifth metatarsal. We'll then add our teardrops. Now, before we do this, we're going to have our patient evert their ankle and dorsiflex their big toe, just to make sure the arch is raised while we're doing the rest of our tape job. We're adding the teardrops from the first metatarsal, coming across the plantar fascia, landing back on the first. Our second teardrop will start on the fifth metatarsal, coming across the plantar fascia, around the calcaneus, onto that lateral side. And we just want to make sure that we're adding 2 teardrops. So adding our second one on that medial side of the foot, across the plantar fascia, and landing back onto the first metatarsal. And again on the fifth, coming across the plantar fascia onto that lateral side, and landing back on the fifth. And lastly, we're just going to fill up any gaps and holes, making sure tape is running lateral to medial. So starting at the fifth metatarsal, landing on the first. We also want to make sure our tape is overlapping the one previous. So we're going inferior about 1/2 inch of tape. And we're just going to apply one more to support that calcaneus. To finish off our tape job, we're going to have our patient relax their foot, and then we'll just apply the anchors. Starting again at that first metatarsal, coming around the calcaneus onto the lateral side, and at the first. And then applying our final anchor, starting at the first metatarsal, coming across the foot, and landing on the fifth. Once our tape job is done, we'll be checking CMS again, so making sure they have enough circulation, motion, and sensation.
After taping our athlete, we need to perform our post-tape checklist. This means checking cap refill, sensation, and movement, looking for windows in our tape job, asking the athlete if the tape is comfortable, and if it is cutting into the skin. We need to bring our athlete into that big toe extension because that was painful for our athlete. And then we need to perform sport-specific tests. So our athlete is a wrestler, so we'll be asking them to perform a toeing off movement or grappling to see if the tape is limiting that painful range.